Thank you, Dr. Cho, for your kind introduction. I'm very privileged to be here today. I would like to give my special thanks to all organizing committee members, including General Chair Pat-Chi Lee, and all those who participate to prepare for such a wonderful meeting. So today, I would like to talk about my clinical experience of ultrasound-guided HIFU. There is a large and growing number of clinical applications of focused ultrasound that are in various stages of research, development, and commercialization. Among them, MR-guided HIFU was approved by American FDA for the treatment of uterine fibroids and bone metastasis. Regarding ultrasound-guided HIFU treatments, bone metastasis is not considered yet to be a good candidate for ultrasound-guided HIFU treatment. However, uterine fibroid is considered to be a good candidate for ultrasound-guided HIFU treatment due to good acoustic window and no motion that the uterus has, and thermal sensitiveness of uterine fibroid. Let me talk about the clinical importance of uterine fibroid. Uterine fibroid is the most common benign neoplasm in women of childbearing age. It is clinically identified in at least 25% of women. Approximately 25 patients are symptomatic with diverse symptoms such as pelvic pain or fullness, dysmenorrhea, menorrhagia, increased urinary frequency, and infertility. For the treatment of uterine fibroid, hysterectomy is considered as a primary treatment for symptomatic uterine fibroid. However, as you know, it is invasive, it needs long post-op recovery time and low childbearing. Uterine artery embolization is considered to be a good alternative to hysterectomy because it is well established that it is effective and well-tolerated procedure. However, it has not negligible major complication rate and minor complication rate. Reportedly, uterine infection, thromboembolic events, uterine ischemia, uterine necrosis, and death can occur. The amenorrhea is reported to be 7.3% after HIFU treatment, which may mean no further childbearing. MR-guided HIFU treatment for uterine fibroid was approved by FDA in 2004 for the treatment of uterine fibroid. It is a safe and effective method of fibroid treatment. It offers the advantage of no incision blood or blood loss, speedy recovery, and cost-effective means of treatment. You see almost real-time monitoring image. So you see red colored here, which means the increase of temperature here. It is a thermometry which enables adjustment of a treatment parameter, and we can monitor tumor response. So the strengths of MR-guided HIFU treatments is, first of all, thermometry, which enables a closed-loop feedback. It provides good tissue contrast and wide field of view. It also provides quasi-real-time monitoring image. You see, G-made MR-guided HIFU here. This figure shows Philips-made MR-guided HIFU machine. This figure shows a company-made ultrasound-guided HIFU machine. this figure shows B company made ultrasound-guided HIFU machine. Using one of these ultrasound-guided HIFU, I reported our initial experience for the treatment of unresectable pancreas cancer. However, I realized that it was too big and too slow from a medical doctor's viewpoint. From a medical doctor's viewpoint, it's important that a HIFU device should provide convenience to handle for time saving. It should provide good image quality for competent treatment. It provides as less space occupying as possible. It should provide good portability for flexible use of the room and patient-centered care. From 2008 to 2014, our center was collaborated with an ultrasound company. Finally, we came to get a new HIFU device as shown in this figure. This new HIFU machine provides a treatment head that easily adjusted by hand as shown in this figure. It also provides electronic steering for time saving and exact, accurate treatment. It also provides a portable system that can be easily moved. We performed a clinical study using this machine and pigs, concluding that it is safe and accurate. You see 256 phased array channel transducer. Red spots indicates temperature sensors that to measure temperature of surrounding degassed water. Blue color spots indicate passive cavitation detection sensors. This HIFU transducer has a focal length of 9 centimeters driven at fundamental frequency of 1 megahertz. Focal size is 1.5 millimeters by 1.5 millimeters and 8 millimeters. Ultrasound power ranges 1 watt to 1 kilowatt. To prevent skin burn, it has a rapid active cooling system with degassed water. Using electronic steering like this, it provides a 3D targetable zone with actual diameter of plus or minus 25 millimeters and larger diameter of plus or minus 13 millimeters. For treatment planning and targeting before treatment, this device provides high-resolution 3D image display by motion rotation, and it provides targeting forecast function for safe treatment. This enables 3D treatment planning. This targeting forecast function provides information on the location of real focus before treatment by insonating weak pulses. Animation movie clip shows how targeting forecast function works. You see red colored here, it means where real ultrasound beam is concentrated on before treatment. It is very beneficial to do accurate, safe treatment. For monitoring during HIFU treatment, it provides interleaved image display and real-time cavitation data. Interleaved image display enables continuous visualization of target lesion. Real-time cavitation data provides information on the degree of biologic effect that might be related to tissue response. This animation clip shows the development of echogenic spot within the tumor during treatment. You can see the development echogenic spot is here. So we see the tumor is ablated with thermal ablation. This animation movie clip also shows cavitation data is fluctuating during treatment. Usually it increases with tumor ablation. We performed a prospective study to investigate the clinical efficacy and safety of this ultrasound-guided HIFU system for the treatment of uterine fibroid. It is approved by our institute, IRB. In all patients, written informed consent were obtained. We included 22 patients according to this inclusion criteria. However, 2 patients were excluded due to the presence of large adenomyosis and small bowel interposition. 1 patient was dropped off due to consent withdrawal. So we finally included 28 myomas of 19 patients. The mean age was 44 years. All patients were treated with HIFU with 3D electronic steering. It was performed by 1 operator. The report parameters as follows. Basically, we performed 5 divided treatments for 6 centimeter tumor. Intensity was 1 kilowatt per square centimeters. Duty cycle was 50%. PRF was 10 Hz. Treatment time per point was 6 seconds. Interpoint transition time was 3 seconds. In this diagram, if there is a 6 centimeter tumors, we performed first treatment at the center of the tumor and then moved the transducer toward 4 directions, like this. We performed contrast-enhanced MRI to monitor the treatment response before HIFU, immediately after HIFU, 1 month and 3 months follow-up MRI. We analyzed initial tumor volume, non-perfused volume, and non-perfused volume ratio at immediate MRI, procedure time and treatment speed, myoma volume change at follow-up MRI, and symptom and complication rate. Let me give you some representative cases. This is a 42-year-old female presented with abdominal distension. You see a large tumor within the uterus. It measured 6 centimeters by 4 centimeters by and 6 centimeters. It is intramural type. Initial tumor volume was 122 cc. We treated 5 treatments. The time taken was 60 minutes. So you see contrast-enhanced MRI before treatment. You see strong enhancement of the tumor. However, immediately after HIFU treatment, this tumor was completely ovulated. 1 month follow-up and 3 months follow-up, the tumor is gradually decreased in size. Initial non-perfused volume ratio was 94%. 3 months later, the tumor was reduced up to 80% initial tumor volume. Let me give you a second case. 47-year-old female was presented with menorrhagia. You see large tumor in the posterior wall of the uterus. The initial tumor volume was 135 cc. The tumor was enhanced at initial MRI. However, immediately after HIFU treatment, the tumor was totally, completely ovulated. It decreased in size over time. The time taken was 99 minutes. Immediate non-perfused volume ratio was 100%. 3 months later, the tumor volume was reduced 77% of initial tumor volume. The amount of menstruation was decreased to 1/3 of original menstruation amount. Let me give you the result of our first clinical trial. Mean volume of fibroid is here. Mean procedure time was taken 49 minutes. Immediate non-perfused volume ratio was approximately 80%. Treatment speed was 1.37 milliliter per minute. 1 month follow-up and 3 months follow-up volume reduction rate is here. So clinically, it is acceptable because procedure time just 49 minutes and immediate non-perfused volume ratio approximately 80%. So we found that it is clinically acceptable. Regarding complication rate, 1 patient presented numbing sensation during treatments. However, it was immediately relieved. There is minimal signal intensity changes in rectus muscle in 4 patients. However, it does not have any associated significant symptom and sign. No skin burns, no sequelae at 3 months follow-up. Symptom was improved. So menorrhagia was improved in 60%, abdominal distension was improved in 42%, dysmenorrhea was improved at 50%, urinary frequency was improved 40%. Regarding treatment speed between MR-guided HIFU and ultrasound-guided HIFU, there was no statistical difference in treatment speed. So the first clinical trial, the included cases were followed up until 3 months according to the protocol in our first clinical trial. However, are we interested in what will happen 1 year later in those treated tumors? We were very interested in. So to see the result after 1 year after HIFU treatment, we performed a 1-year follow-up study. From 19 patients of first clinical trial, 16 fibroids of 11 patients underwent 1-year follow-up MRI. So 1 month, 3 months follow-up, and 1-year follow-up. So we can say that 1 year after HIFU treatment, the tumor was reduced up to 43% in average. Average. So also, the tumor was slowly reduced in volume over time. Let me give you an example. You can see 3 tumors in the uterus, 1, 2, 3. We treated 2 tumors among them, so it decreased in size over time. So in at 1 year follow-up study, this tumor decreased up to 31% and 43% in volume reduction. However, you see third tumor was increased in size. So screening and 1-year follow-up MRI. So what is the best option for these patients to treat this third tumor? Hysterectomy, embolization, leave it alone, ultrasound-guided HIFU, MR-guided HIFU. We treated with ultrasound-guided HIFU for this tumor. So this tumor was completely ablated on immediate post-MRI image. We performed the second clinical trial to accumulate our experience to treat uterine fibroid. It was performed since December 2014. So far, 21 fibroids or 12 patients were treated. Screening MRI, immediate post-HIFU MRI, 1 month and 5 months follow MRI were performed. The fibroid volume screening is here. Initial non-perfused volume ratio of 21 fibroids is approximately 80%. It does not show any difference from clinical trial in terms of fibroid volume screening and initial non-perfused volume ratio. At 5 months follow-up, this tumor was reduced in volume of approximately 45%. Symptom was also improved in 8 patients with menorrhagia, 88% patients were improved. And in 4 patients with abdominal distension, 75% improved. 2 patients with constipation, 100%. 5 patients with frequency, 80%. 6 patients with dysmenorrhea, 83% of patients were improved. And no significant adverse effect. So if we compare first clinical trial and second clinical trial in terms of symptom improvement, menorrhagia, abdominal distension, constipation, frequency, dysmenorrhea. So second clinical trial showed a little bit higher symptom improvement rate, probably due to accumulation of treatment skill. So anyway, we can confidently say it is surely effective to treat uterine fibroid and to diminish uterine fibroid-related symptoms. A patient told me, this menorrhea has annoyed for a long time, but it was so gone that I'm very happy. I completely returned to normal. Another patient told me that I had frequency abdominal distension and menorrhagia. It has destroyed my life for a long time. All of them are almost gone. I appreciate your help. My friend doctor asked me to treat his wife. What should I do? If something happens to his wife or the treatment is not as efficient as I expect, I will surely be in shame. However, without hesitation, I treated her with confidence because I know it is safe and effective. This tumor is here. It is almost ablated on immediate post-HIFU MRI. Immediate non-perfusive volume ratio was 67%. In summary, MR-guided HIFU provides real-time, almost real-time monitoring. It provides thermometry. It provides excellent resolution. However, it is expensive. It is able with targeting assurance is able with thermometry. Power adjustment is able with thermometry. Scanning range wise. However, it has contraindications such as metallic implants or claustrophobia, whereas ultrasound-guided, pure, truly real-time monitoring. However, thermometry is unable. The resolution depends on many factors. However, it is very economical. It is able with pre-focusing for targeting assurance. Power adjustment is under research. Scanning range is small. Contraindication is almost absent. Uterine myoma is a very good candidate for ultrasound-guided HIFU treatment. It can be treated safely and efficiently by ultrasound-guided HIFU. Electronic steering, targeting forecast function, good image quality during treatment, easy manual handling of transducer, and cavitation monitoring might increase efficiency of HIFU treatment. However, more investigation is needed to apply for other organs, such as pancreas. Thank you for your attention.